Hello friends, I am Dr. Saman. Welcome to Frontal Lobe. So in this lecture we are going to cover about fine motor milestones. We have already covered gross motor milestones, and in this lecture fine motor milestones will be covered. Now fine motor milestones are about the coordinated activities of hands, especially involving hands of the baby and as well as eyes also. So the coordinated skills of both the hands, fingers, palms, etc. and the eyes, it will be covered under the heading of fine motor milestones. So what are the important fine motor milestones? So what happens at 3 months of age? Hand regards come. Hand regard means the infant is regarding that he has hands, right? He is intently watching towards his hand. Hand regard. So intently watches, infant intently watches towards his hand. This is hand regard. This comes by the age of 3 months. At 3 months of age, another important milestone comes, which is infant holds an object when placed in hand. When you place an object in the hand of infant, he consciously holds it, meaning that palmar grasp reflex is gone. So initially what was happening for a newborn, when you keep your finger between palm will be closed automatically. So this is by reflex, palm was getting closed. So now the palmar grasp reflex is gone, and the infant purposefully holds any object when you place that object in his hand. So two things. First, hand regards. You can see in this beautiful picture the infant is intently watching towards his own hands. So hand regards comes at 3 months of age, and then infant holds an object when placed in his hands. This also comes at the age of 3 months. What happens in 4 months? Very important. Hands come in midline. This happens at 4 months of age. It happens at 4 months of age. At 4 months, what happens that the infant tries to reach for the object. So if anything is dangling above his head, infant is lying, so mine and anything is dangling over his head, he will try to reach for the object. So infant tries to reach for the object, and the hands come in midline. These two things come at 4 months of age. So another, this beautiful new edition of Ghai has beautiful picture of milestones. You can just look at the pictures and remember them. They're very beautiful pictures, very scientific pictures. So this is at 4 months the infant hands come in midline. 3 months pe hand regard, infant is watching his hands. 4 months pe hands come in midline. 3 months pe when you place any object in the hands, infant will grasp it, and 4 months pe he tries to reach for objects. So 3 and 4 months, these two important things you have to remember. Now again what happens, you can see in these pictures, if you put the dangling objects above the head of the infant, what will happen? At 4 to 5 months of age, infant will reach for that object with both the hands. So this is bidextrous grasp. Whereas in this picture, you can see in this picture the infant is holding this object rattle with the help of only one hand. So this is unidextrous reach. So bidextrous reach is between 4 to 5 months of age, and unidextrous grasp is between 6 to 7 months of age. Between 4 to 5 months, see, every milestone has a range, right? So some infant will reach earlier, some infant may take some more time, right? So there is always a range. So you have to choose the closest option, right? When you get the milestones, MCQs on milestones, you have to choose the closest option. So bidextrous grasp comes by 4 to 5 months of age. Unidextrous grasp comes by 6 to 7 months. So another advancement occurs once the unidextrous grasp is reached, that the baby is able to transfer object. Remember, this will happen only when the baby will be able to hold object in one hand. Then only he will be able to, suppose this is an object, and when the baby was holding it with both the hands, he will not be able to transfer. But once he is holding it in his one hand, he can transfer it to another hand. So transfer, unidextrous grasp and transfer of object comes at the age of 6 to 7 months. Understood? More about grasp बहुत important है fine motor milestones में, so please pay attention. Now when you what happens initially when once the unidextrous reach is reached, once the infant is tries to reach for an object, what happens, radial side में पहले वो radial side से grasp करेगा. Suppose this is an object, right? This is an object kept on a surface and यहाँ पे आपने infant बिठाया, तो वह he will come and grasp this with the help of his ulnar side. So this is ulnar side, this is radial side. Radial side means thumb. He is not involving thumb. He will be using his ulnar side. So this is palmar grasp or crude ulnar grasp. This will come at 6 months of age. Initially the baby will try to reach for the object with the help of radial side of hand. What is intermediate grasp? Intermediate grasp means now he is able to use middle part of his palm, part of his palm, right? So he is using like this, he is holding like this. This is an intermediate grasp. This comes at 8 to 9 months of age. So now the baby is holding the object with only one hand. Initially the crude radial grasp come at the age of 6 months. At the age of 8 to 9 months, baby is able to hold object between using the middle part of his palm, that is crude intermediate grasp. And by 10 months of age, baby is able to use radial side, you know, thumb and index finger, radial side, most advanced. By 10 months of age, the baby will be able to hold an object between thumb and index finger. So this is radial grasp. Now let's see at the pictures. So in these pictures you can see this is if you pay attention on this picture, so an object is placed on the surface and the baby is using like this. So he is using his radial side to grasp this object. This is palmar grasp and it comes at 6 months of age. Later the baby is able to hold between using middle two fingers. He is crude radial grasp. This is crude radial grasp and it comes between the age of 8 to 9 months. So he is using these two fingers. Can you see? Can you notice in this picture that the baby is using these two fingers and thumb to hold the object like this as I told you, and some palm also, but not the entire palm, some palm. And the more advanced one is mature radial grasp, when the baby is able to hold the object using the thumb and index finger. This comes at the age of 10 months. So again, let's revise again. Bidextrous at 4 to 5 months. Unidextrous and transverse object between 6 to 7 months. 6 months mein initially the grasp will be palmar. Baby will be using his radial side. By 8 to 9 months, 8 to 10 months, crude intermediate grasp will come, and by 10 months of age, radial grasp will come. Now after 10 months, what will happen? Now baby will be able to hold small objects also. I don't have a small object over here. Let me check if I have anything. So if you place a few pellets in front of infant, what will he do? He will grasp. Now this is more difficult. Holding this is easy, right? अगर कोई छोटा object है तो holding that is more difficult, that is more advanced skill. Understood? So pincer grasp means holding something in between thumb and finger. It comes at 10 months of age. 10 months में वो भी आ रहा था, ये जो ऐसे कर रहा था बच्चा, ऐसे कर रहा था, right? But pincer grasp is of two types, immature and mature. So what is immature pincer grasp? So imagine something is kept, ठीक है? So initially what will happen, the baby will not be able to pick it like this. He will take some help, take some support from the ground and reach for the object and then hold it, right? Later on what will happen, the infant will be able to grasp an object, grasp a pellet directly from the surface without using the support of surface. Understood? You can see in this picture, what is this? Is immature pincer grasp. Why immature? Because you can see that entire these other fingers and palm of the baby is resting on the surface. He is taking the support of the surface, whereas in this picture this baby is more advanced. He is picking food from the bowl and he is not taking the support of any surface and is picking it with the help of just thumb and index finger. So this is mature pincer, nothing but mature pincer grasp. So immature pincer grasp comes at 10 months of age. Mature pincer grasp come at the age of 1 year or 12 months. 1 year or 12 months. So ये सारे आपको याद रखने हैं. Bidextrous reach by 4 to 5 months. Unidextrous reach by 6 to 7 months. At 6 months of age, palmar grasp will be there. Between 8 to 9 months, intermediate grasp will be there. And by 10 months, radial grasp will be developed. Initially, it is immature pincer grasp at 10 months and later mature pincer grasp at the age of 12 months. So this is about grasps. So this is very advanced hand skill involving some hand-eye coordination as well. Understood? Let's come to hand to mouth coordination. Hand to mouth coordination means baby को खाना खाना भी सीखना है. Understood? So mouthing means होता है everything, whatever, you know, if you give anything, any rattle, any toy, anything to the infant, he'll take that thing to mouth. He'll keep that thing in mouth. So mouthing comes by the age of 6 months. By the age